I will start now. Welcome everyone to this Creative Health Review webinar roundtable on health inequalities. I'm Alex Coulter, Director of the National Centre for Creative Health, and we are managing the Creative Health Review in partnership with the All-Party Parliamentary Group on Arts, Health and Wellbeing. Thank you to all our audience for coming today, and we are in Zoom webinar mode, which means that we can't see you, but we would love you to say in the chat who you are, where you come from, and you do talk to each other, share links, share ideas in the chat throughout the event. This is the second roundtable of 7. The first was on mental health, and you can now watch that on YouTube. We are recording this roundtable too, and it will be made publicly available in the next week or so. There's lots of other information about the Creative Health Review on our website, and we also have a call for contributions, and Alexis will put the link for that in the chat. Later in the session, there will be a chance for you to ask questions to the speakers. You can see at the bottom of your screen that there is a Q&A box. Please use the Q&A box for your questions rather than the chat, because obviously the chat gets very busy and it's easy to lose questions. And when you write a question, we'd be very grateful if you said which panelist, which speaker you would like to answer the question, and target your questions to individual speakers. So please note in your question who the question is for. And so I am going to hand over to Professor Helen Chatterjee, who's going to chair today's session. And Helen is Professor of Human and Ecological Health at University College London, Biosciences and Arts and Sciences. And she's also Research Programme Director for Health Inequalities at the Arts and Humanities Research Council, UKRI. So she's also a trustee of our organisation, the National Centre for Creative Health. So over to you, Helen.
Thank you, Alex, and it's really lovely to be here. I'm really excited to be chairing today's session. We've got a fantastic range of speakers for you, so I hope we can have a really lively discussion engaging with the brilliant content that these guys are going to be sharing about their learning today. So I'm not going to say very much. As Alex says, we're working around this topic of health inequalities, but we recognise that this is a real area of growth in terms of both our understanding of what that means for the real lives of real people, and that to that end there are many different definitions for health inequalities and even terms used. Some of you may be familiar with the term disparities, which, for example, OHID, the Office for Health Improvement in Disparities, has adopted, and perhaps some of the controversies around these terms. We're using the term health inequalities to mean unfair and unavoidable differences in physical and mental health outcomes for different types of populations, which can occur between different groups in society. And what we're including is outcomes that can include anything from life expectancy, years spent in good health, quality of life, but also in terms of, for example, access to things like services or assets, community assets, resources, spaces within the community and within the neighbourhoods that people live. So that might include good quality care or access to good quality services. We know that there are many different uses of the term, and also what that means in terms of the sorts of populations, individuals and communities that we're working with. So many of you, if you're interested in the NHS or you're coming from an NHS perspective, you'll be familiar with Core 20+5, for example. So we're really interested to know what that means for you and the audiences that you're working with. We know that health inequalities can occur between ethnicities, across socioeconomic gradients, and in groups who face barriers to accessing different aspects of health and social and other services, as well as the impact on individuals. Of course, this places many aspects of burden on those different services. And of course, the pandemic has highlighted and exacerbated inequalities. And that's largely why we've been hearing much more about inequalities, isn't it, over the past 2 or 3 years. But I think many of the reasons that we're all here today is that we have an appreciation that creative health approaches can be used to improve health outcomes, to co-produce appropriate and accessible services for groups who experience barriers to access, and to develop culturally appropriate, stigma-free health promotion and disease prevention initiatives, some of which we're going to be hearing about today. And the sorts of work that you're going to be sharing today and the discussion that we're going to engage in today will all feed into the Creative Health Review, as Alex has mentioned, and this Arts and Humanities Research Council-led Health Inequalities programme, which is a £27 million investment from UK Research. It links in with the other research councils, including, for example, the Economic and Social Research Council and the Natural Environmental Research Council. And what we're interested in is how community-based approaches are helping to tackle health inequalities, but also what some of the challenges and barriers, but also enablers are in terms of that style of working, and how we might all work together collaboratively more effective to be able to reach those individuals who are facing the worst inequalities that are living in the most deprived areas. So without further ado, I'm going to launch into our next session, which is really where we're going to hear the nitty-gritty of the fantastic work that some of our panelists here today are going to be sharing with us. So we're going to spend the next 45 minutes or so hearing from a series of different panelists coming from different perspectives on how they think creative health can help address health inequalities. First of all, an apology from one of our speakers, Sandra, who sadly cannot join us today, which I'm really sad about. Sandra Griffiths was the founder and director of the Red Earth Collective, and she was going to be speaking us to sharing her experience of addressing health inequalities experienced by Black communities. Sandra's unfortunately not very well today, so she sent apologies, but she does really fantastic work through her organisation, and we're going to make sure that the evidence that she was going to share today is fed back to our commissioners and captured in the review. So an apology from Sandra to start with. We've got three brilliant speakers who I'm going to introduce next up. Then we're going to hear from a few more speakers, and then we'll take a short break and then have a bit of a discussion. So please do start storing up your questions. As Alex says, please do post them in the Q&A. And if you've got a specific speaker that you would like to target your question at, let us know. Or if it's a more generic question that you'd like our panelists to respond to, then also let us know about that. So I hope that sounds okay. Please do post us queries in chat if you've got it, but questions in Q&A. And without further ado, I'm really, really pleased to welcome our first speaker, David. David Tovey is co-director of the Arts and Homelessness International charity. And so we're really excited to hear about your experiences, David, and why you set up your organisation. So thank you very much for joining us, and over to you.
Good morning, everyone. Hopefully, I'm not going to mess up today. I'm having a hell of a week, right? And I thought, actually, I'm going to come along because this is the whole point of why we're all here in this space today, right? Is to go, right, sometimes we have bad weeks, right? And those weeks can stretch into months, etc. I've been off sick for 10 months as part of like ill health and mental health and stuff. And we absorbed that into our organisation. So instead of having to go onto the government benefit system, I stayed in the position I was at as co-director, and it works, right? And we're just trialing this at the moment. But I'm going to come to that a little bit later on. I just thought I'm having a bad day, right? I'm going to get it out there straight away. So we're Arts and Homelessness International. I'm David Tovey, one of the co-directors. Matt Peacock is the other director. Sadly, he's at home nursing some wounds at the moment because he was in an accident. So he's actually watching online, so he would text me when I mess up. So what do? We bring positive change to people, places, and policy. That's our main goals with what we do, and that's across an international network of over 500 organisations and councils, municipalities, etc. What I wanted to cover, because I was trying to work out the best sort of like bits to talk about as an organisation that could benefit this project, right? And it was so difficult because we pretty much are what you're looking for. And so I was like, right, okay, I'm going to have to try and whiz through as much as I can. If people want to know more, they can contact us, right? So back in, I think it was about 2016, we set out a literature review on arts and homelessness across the world. And we found across 61 organizations who are working and focusing solely on the, arts being one of the focal points for their well-being within these organizations. I'm just going to find the slide so I can actually give you everything like as it is. So out of the 61 organizations, we had, my computer's sticking. This is the joy, isn't it? We have to get used to. There was 4 main structures that we found across all these organizations, that arts had this ability to sort of like go a little bit deeper than what other stuff does. And that was well-being, agency, resilience, and knowledge and skills, right? These are 4 main areas that this report showed. Yeah, I think it was like 61 organizations, 24 visual arts, etc. You can find this all on the website. I won't go through it all. Through that report, that gave us the grounding and information and proof that arts within our sector, the homelessness sector, has an impact, right? And for us, that's what we needed. So then we could then go, right, okay, now let's start seeing if we can now implement changes through this, right? So we then set about setting up a cultural spaces responses to homelessness training scheme. We set this up with Museum of Homelessness originally to work it out with people with, in a co-produced way completely, to sort of like look at, you know, we know the good things that are happening out there, but there's always that fear around homelessness, right? So, and you were talking about access. This is something we struggle with our community so much. Just from a simple thing as a door check, you know, that is a huge barrier, because how would you like someone walking through your front room, moving all your chairs around and then leaving again? And that's what it's like for a homeless person to have a bag check. You know, you're going through their worldly belongings, right? So we sort of like go to culture spaces and we train them, and we work around easier ways of, you know, make it a little bit more accessible and, you know, fair for everyone. Like, you know, at the end of the day, we all just want to enjoy some art, don't we? And that's the main thing. So if I can just reopen this, sorry, I do apologize. Actually, no, I don't apologize. This is just me. Anyway, right. Where did I get to on this list? Yes, and then we started looking at this and thinking, actually, we can go a little bit deeper even more, right? To try and look at policy change. And this, for us, is a really important part of the work that we do, because if we don't set this in the system, right, and actually have it at a base level, city, cultural spaces, council level, then you're never going to have a proper funding, engagement, never be taken seriously, you know, and this sort of thing. So we work with councils to sort of do co-production training, but to embed arts into their homeless strategies, right? So instead of it just being about housing, it's about giving them tickets to go to cinema, to actually have access to go and make some art, you know. It's that all round figure of work that we do. We're rippling it out through. We did it at Coventry City Council. I'll tell you. And anyway, I'll move on, like, because I'm going to run out of time otherwise. From that, we created this model called Jigsaw of Homeless Support. You can just Google it; it's everywhere at the moment. And what happened with that? Because we look at a person-centered focus, this became everything to us. Like, you know, it should be, what is it you need from us to make your life a little bit easier, right? So we look at that in a sense. So we put it into this big triangle jigsaw, because if one part of that falls out, you know, it stops working, like that support mechanism, right? So that's now been adopted by the UN as a practice of a best practice. Come on, David, you can say this stuff. You know what? This is me. And then from that, we're now looking at going even deeper to now look at fair pay, right? We are an umbrella organization working across the world, and there are other umbrella organizations, art and criminal justice, etc. So we're coming together to sort of like start working around fair pay. How can we work with people co-produced if they get sanctioned and they lose their benefits? right? It's not fair, right? Because they're trying to get work to better their life, and there should be some sort of mechanism to get people back into work. From that, I'm going to go into my world now. Obviously, I look at this, right, from us as an organization and what we do. I see it from what happened to me when I was homeless, right? And I think this is why I did turn up today, because I'm not feeling well, but we're really passionate about making this change, right? We have to. For me, it saved my life, right? Arts gave me that access, right, to see the world differently, and for the world to see me differently. When I was living on the streets, I had a camera, right? And I'd be walking around at night, and instead of like having this stigma attached to me as that homeless dude type thing, they saw you as an artist, right? They saw you as a photographer. So you were sort of like given that up step already. So from that, for me, that's what empowers people. That's what picks people up. That's what gives them the good well-being, the resilience. You've got to have so much resilience to be homeless. I always say to Matt, homeless people are the best networkers in the world, right? And they can get anything done. So from that, we then build our structure as a company with the lived experience. We bring well-being into that structure. So for instance, like I was saying at the beginning, I had 10 months off, and there was that fear straight away going, oh my God, if I lose my job, I'm back out on the streets again. And I don't ever want that to happen again. So we've started to look at this. We're flattening the pay levels. We're bringing 2 producers on every project. So even if one person has to take time off, we've got a second producer there who's like up to speed with it. And then myself and Matt go in and work on that project as well. We have well-being budgets where the staff can go and spend it on whatever they want, like whatever they want, no questions asked, right? And if they have to take time off, take it off. Like we're working as a team. There was something that used to be said in the army when I was in the army, was we march at the speed of the slowest person, right? And so if we have to postpone events, we'll do it, because at the end of the day, our staff is the most important thing, and the community that we work for. I think I'm running out of time, haven't I? If there is anything that people want to know, they can contact me or ask questions later on. But yeah, everything's up on the website if they want to know more stuff. And I'm sorry I overran.
David, that was absolutely brilliant. Thank you. Really fantastic. Thanks so much for sharing your insights, and especially when you're not feeling full par, we really, really appreciate it. Thank you. And anything you want to add to the chat? I know lots of people have been commenting and saying thank you, and how fantastic your insights have been. It's super, super helpful, super informative. Thank you very much for sharing your experiences. So really appreciate it. And stick around, because I think you're going to get lots of questions coming up.
Yeah.
So, thank you again.
Thank you, I appreciate it.
So next up, we're going to hear from Rose. Rose Sargent is a health and science producer at Contact Theatre in Manchester, and we're really looking forward to hearing your thoughts and ideas. Thank you, Rose. Over to you.
Thanks so much, and thank you, David, as well. That was really, really interesting. And I think similarly to you, I'm just going to be able to give a brief snapshot of what Contact does, because our work is very broad in addressing health inequalities. I'm just going to share my screen for a presentation. Oh no, hang on, sorry, 1 second. Right, okay, there we go. So I'm Rose, my pronouns are she, her, and I'm health and science producer at Contact. If you're not familiar with us, Contact is a multidisciplinary arts organisation where young people lead. 5 out of 9 of our board members are aged between 18 and 30, and young people are central to making our board appointments and staff appointments across our organisation. We're based in Manchester, a city region with a creative health strategy link. We're based in Manchester, a city region with a creative health strategy, which I'll pop a link to in the chat after the presentation. Contact is a space for care, curiosity, and creativity, and we reopened our building in 2021 following a major redevelopment project. Within this, we secured funding from the Wellcome Trust in 2017 for a new health and wellbeing space, which is Space Zero, as you can see on the screen. It's the first of its kind in a UK performing arts venue, and we secured funding for a 4-year health and science producer post, which is currently funded until April 2023. However, Contact has a long history of working with how health, science and art intersect, working previously with partners on shows such as I Told My Mum I Was Going on an RE Trip, which explored the experience of young people and abortion laws in Ireland, and There Is a Bright Light, which brought together young people, researchers and health professionals to explore specialist treatment for teenage cancer patients. Dedicated funding for the Health and Science programme has allowed us to grow this work. The impacts of these projects address health inequalities on multiple levels, providing visibility of experiences, education, and reducing stigma and isolation. Our approach to producing work is with equity, looking at how we can bring people together to platform aspects of health less discussed. We work with health professionals, researchers, and expert organisations to provide robust support environments for people to do this. In 2017, we worked with BHA to present I Am Because We Are, a play exploring the realities of HIV-related stigma in Greater Manchester. Research indicated that late diagnosis rates were high and Black African communities were disproportionately affected. The show was written by Cheryl Martin and based on testimonies and toured across the regions to venues, but also community centres and drop-in services. Our aim was to give audiences an insight into daily life with the condition and bust myths around living with HIV to create more shared understandings. And just on this, you can see our cast, but also some feedback from our audiences as well. And I could happily talk to you about more of our projects, but I do want to move us along to talk about what else we can do within art settings. If you're interested in getting in touch and finding out more about what we do, my email will be shared on the final slide at the end. So what else can we do? I believe this is in part through our organisational structures and values. We need those in place to provide exceptional care to those who engage with us. This year, we launched the Greater Manchester Arts and Trauma Network, working with Manchester University, Oldham Coliseum and Manchester Art Gallery to create an offer for community arts practitioners to greater develop their learning and resources around trauma-informed practice. Contact is also developing a manifesto of care, which outlines key principles for support. On this slide, you can see some of our key questions in relation to this work, and two of our young artists, Palumi and Audrey, who are co-commissioned to create some artistic works responding to the themes. We also champion the social model of disability and have developed an anti-racism training package, which is core training for all staff. This has also been delivered across Greater Manchester organisations, and we have a working group that meets regularly and offer consultation with our communities and young people around our anti-racism work. Our organisational principles are key to creating inclusive and supportive environments for those who engage with us. As we're all aware, these are increasingly difficult times, particularly for our young people who will feel the impact of the cost of living crisis, and this will undoubtedly have a huge impact on health. With our school curriculum having reduced access to creative subjects, it's not as widely available for all young people, and in the arts, we need to be responsive to the needs of our participants and how we can reflect the current climate, whether it's providing free drop-in creative activities, low cost or free tickets to our shows, or by providing travel and food costs within our project budgets. All of these can have an impact on well-being. For the last 2 summers, we have run a free creative summer camp for young people, which has included a range of music, arts and drama activities with a free hot lunch each day. We focus on where and how we should deliver our work. The agency is a leadership development programme delivered in Moston and Harperhay, regions of Greater Manchester impacted by socio and economic circumstances. The agency team's approach involves chatting to young people hanging out in the area and inviting them to come in and join the project and paying them for their time. Another example of our work is last year we delivered an online project for disabled and neurodivergent people, mindful that many of them were still clinically vulnerable. In challenging health inequalities, it's important for the arts to be responsible and flexible. So, to wrap things up, I believe the link between arts and tackling health inequalities only gets stronger with increased visibility to this work, and the need is great to support the well-being of all our residents. We must continue to develop this, working closely with researchers and partners to offer robust, supportive and responsive opportunities. And we can also share our work widely, not just in our venues, but in our community settings and centres across our region, engaging new audiences in these vital conversations. And we can also provide creative spaces just to be creative, because we know that that has a great impact on well-being. And we can develop our staff teams and provide individualistic approaches to support. So please do feel free to get in touch with me. I'm really proud of what we do at Contact, and I'd love to talk to you further about that. I'll also pop the strategy for creative health in the chat after this.
That's fantastic. Thanks so much, Rose. Really fantastic work that you're doing. Many congratulations. I'm really pleased that you've been getting some great funding as well. Long may that continue. And thanks for sharing your insights. Brilliant stuff. So next up, we're going to hear from a few speakers who are working across specific places, and we're going to hear their insights about addressing inequalities and the challenges of tackling those wider determinants of health. So really appreciate their insights coming up. So first up, we're going to hear from two speakers from East Marsh United, which is an organisation based in Grimsby, Josie Moon and Kelly McLaughlin. Over to you, Josie and Kelly.
Hi, everybody. Well, that was inspiring, Rose. Thank you so much. We'll definitely be getting in touch, and David as well. This is amazing. It's a real honour to be here today. We really appreciate the invitation. So here we are in sunny Grimsby, over on the East Coast. And so I'm going to tell you a little bit about where we are, why we are, what we do, etc. And I've got a couple of slides to share with you. So I'm going to just share my screen. And oh, goodness me, that's very small. Oh, there we go. Can you all see that all right?
It's coming, Josie. I think you just need to go in presenter view.
Okay. Can anyone see that?
We can see we can see your slides, Josie. If you just go into slideshow, or right at the bottom of your screen on the right, the little picture of that's it. That should.
There we are. Okay. All right. So,
brilliant.
So where are we then? Where the East Marsh United is based in the East Marsh of Grimsby, where men live on average of 12 years less than men in the very next ward. The East Marsh is the lowest performing ward in England in terms of education, training and skills, and has been so since 2004. Our streets are blighted with wheelie bins, fly tipping, boarded up and empty homes, houses unfit for human habitation, where tenants are rinsed for rent by frankly criminal landlords who allow rat infestation, black mould, dangerous electrics and even basic repairs to go unattended. So this is the street I live on. This is what it was like in 2017. So why are we? Well, East Marsh United was born out of crisis in 2017 when county line drug gangs took our streets and created a culture of terror. A public meeting was held where ineffectual officials offered no solutions to an increasingly angry group of powerless residents. Billy Dazine, our chair, stood up and spoke for 20 minutes, organised a workshop on broken window theory, which attracted 15 committed residents. EMU was born, and its first act was to take to the streets every Saturday morning and clean them, people's own brooms and bin bags. The direct action caused a stir, and gradually the organisation grew into what it is today. So what do? Everything, all at once, all at the same time. That's our MO. You cannot tackle housing inequality without talking about poverty or health or education or human rights. Over the past 5 years, EMU's developed a range of projects and partnerships to offer upstream rather than downstream solutions to the problems that people in our ward face. These projects intersect and all contribute to the ambition to transform the ward into a village community where people have decent homes, clean streets, friendly neighbours and engaged, enjoyable lives. So what's happened then? Well, it took the end of the fishing industry, Thatcherism, the sell-off of social housing to privateers and austerity to destroy the East Marsh, 50 years or so. In 5 years, we have not unsurprisingly reversed the decline. But we have made a start. EMU is now an ethical social landlord with 3 warm, safe homes for tenants who are valued and cared for. Our community share offer this year raised £500,000, and we're buying a further 7 to 8 houses with that money to provide families with decent homes. It's not enough. Our ambition is to have 100 houses for 100 years, so that EMU can have a sustainable revenue stream to pay core staff, and so that continuous investment in housing can take place. We want this EMU vision to extend into the coming generations, an upstream approach to social change. We've begun a community wealth building project to prevent wealth extraction and to encourage investment in our local community economy. This project has a real head of steam and looks to be our biggest success over this coming year. We run an education project with the WEA. We have a reading group and have started a film club and a podcast, our East Martian Chronicles, as part of this programme. The WEA is also supporting our community garden, a new development of a piece of wasteland in the East Marsh. We've run a successful and innovative grassroots community arts project since 2019, funded by Creative Civic Change. In that time, we've created a community choir, writing group, emergent community library and recording studio. We have a weekly drop-in and monthly engagement in our local park. We've delivered music, storytelling, art and craft, theatre and outreach events over the life of the project, and currently looking at how we're going to fund this going forward. The funding circus in the UK makes life incredibly hard. The arts project has not been an add-on, it's been central to all that we do, informing our practice, creating opportunity and joy for people in the community who benefit little from local or national cultural spending and investment. Going forward and looking ahead to 2023, we've got work to do. We need to scale up. We have 2 full-time members of staff, 3 part-time and 2 working for free. We have to strengthen our core, secure good staff and build a sustainable business model. The health of our organisation depends on that, and the work will not continue unless we manage to secure the basics. We know we're a rickety ship. We've evolved as a responsive, person-centred, needs-led organisation. Our strength lies in our relational practice and our core values of trust, openness and empathy. We have outstanding working relationships with local and national partners that make what we do possible. Now we need resources, and we're not alone. There are thousands of good people trying to do the same things as us around the country, witnessing the human impact of inequality, injustice, cruelty and state abandonment every day. Is there any wonder that people's mental and physical health is so badly impacted when there is so little commitment and investment in actual human beings living their lives? But we have hope, and by modelling for better and believing in better, change can happen. We must imagine a realistic utopia with human flourishing at its heart. We must take our courage, find the others, and we must accept that in our lifetime we may not win, but we must try. Anything else is unconscionable. And we finish with a joyful photograph that Kelly took of our recent community celebration, where we can see the power of coming together to enjoy the arts. Thank you so much for listening. I'm going to hand over to Kelly. I'll put some contacts for everybody in the chat. Many thanks.
Oh, well, thank you, Josie. I'm getting emotional a little bit there, Josie. You do it to me all the time, don't you? It's obviously, it means a lot to me. Thank you for having me here today, because this subject is so important to me. For many years, I have battled with mental health and other traumatic subjects, domestic abuse and so on. I have to write this down because I'm going to go off the track and I really want to get to the point. So I am reading off from a speech what I wrote. But one day I met this amazing lady, Josie Moon, at the market. Just by fate it were, I got introduced to this creative writing group. And I say fate might sound like I'm talking like a fairy language. No, it wasn't. Because that day when I was at the market, nearly 3 years ago now, I wasn't stopping in Grimsby. I didn't know where I was meant to be. I lost my mum, sadly, to cancer. I was then made to be homeless because I was living with my mum. So she was over 50s property. Come from a broken family, lived in the care background and raised myself up from the age of 13. So you can imagine I've gone through a lot and my well-being has took a lot of effect. So yeah, you can appreciate it's been a big strain on my well-being, and my welfare was a struggle with challenge after challenge after challenge. But getting introduced to this creative community, my life has changed for the good. I attended regular creative workshops to help me express my feelings, sorry. It also helped me conquer a lot of them challenges. By joining a writing group, I was dealing with a domestic violence case at the time, waiting 3 years for this guy to get my justice on this guy, to get my freedom back. And when I first started this writing group, I kind of broke down with him and said, I'm going through something at the moment. I need help to put pen and paper, put words to pen and paper. And wow, we did that all right. They helped me express what I needed to say. And that judge heard me for once. After 6 years, 9 years in total, battling with court justice, systems letting me down, after time after time after time, this amazing creative writing group gave me my voice back. I'm drifting a little bit there, I knew I would, but I can't express how much that meant to me, you know, that they helped me put words to paper and how I really wanted to express it to that one man, what was going to change my life and help me get my freedom back. I'm just going to need to get where I am again. So obviously I honestly can't say I could have achieved what I have done since joining this community. Living in this community has given me a home. When I was feeling scared, it gave me a family when I thought I was alone. But more importantly, it helped me grow and gave me my roots back. Writing saved my freedom at court, like I've just said. And now I have a growing photography business, which I have found a niche for being a community photographer, meaning I want to help the community. I want to help take photos on affordable prices to share awareness. But most importantly, I'm writing a book to help share awareness from all my traumatic issues I've gone through. To really like get the word out there to people, like, you know, this is what's going on. Communities are so important. A stranger of a community helped me that day. This lovely lady heard me, saw me. She saw something more than I didn't see that day. Took me in, opened me up, and wow, gave me, and the East Marsh as well, the full community gave me so much more. So creativity is so much more than just creating art. For some, it helps rescue those ones from the darkest days. For me, it helped me be a part of a community, helped me be heard, it helped me give me my voice back. And I'm proud to say now I'm a community organiser, all due to meeting this lady. I didn't even know about East Marsh United. And wow, 3 years later, I'm growing and growing and growing and growing because I've got a community. But more importantly, though, I need to express how important it is to fund these sort of things, because statutory services are failing due to lack of resources, lack of funding, cuts. I'm sick of it. I have been failed and let down. And that was when I was 13 years old. I am 38 years of age now. Thankfully, I had this community. If I didn't have this community when I lost my mum and didn't know where I was going to be, I honestly don't think I would be alive today. And I'm not exaggerating over that. I'm proud to say I'm an ex-self-harmer. When I was younger, and them days were coming back again where I really wanted to self-harm, but they wouldn't let me because they gave me more than just hope, and they gave me everything what I deserved. And Saturday services, doctors, Navigo, Open Minds, Mind. I'm waiting for referrals still to this day to get help to help me. But writing group did that for me though. It gave me my therapy. It gave me my peace, and it is my family. Do you know? So I really don't. I think I've gone off track a little bit. I do apologise, and I got a bit passionate. But yeah, I just can't express how much all these communities are so important for us all. And thank you for letting me speak.
Kelly, thank you so much. What such powerful messages you've been sharing and your experiences. We really, really appreciate it. You're getting so much love in the chat, so please do read that. Thank you. And to Josie, I mean, that just as you've beautifully spoken about and articulated there, Kelly, the power that being so involved in your community has helped you overcome personal challenges, but also navigating those systems and helping you to achieve your goals and the workarounds that we all need to have in terms of things like statutory services. So that is super powerful. We really appreciate it, and many congratulations to you and Josie and the rest of the team who were running. I mean, just such a fantastic organisation. Many congratulations to you, and thank you for sharing your experiences. I think you're going to
ignoring anyone on the messages, but for some reason my keyboard's not letting me do my space. So if anyone wants to email me, and I am reading the messages, so thank you very much. But yeah, I just can't message back on Zoom for some reason.
Oh well, thank you for letting us know. We can do link ups where necessary, and I think Josie's already put her details, and we're recording today's session, so that will all be available as well. Thank you so much, Josie and Kelly. Absolutely fantastic, really powerful. So next up, we're going to hear from Liz. Liz Morgan is Director of Public Health, and she's a really committed advocate, taking those experiences that Kelly has so beautifully articulated there to think about how that can be integrated into public health and how that links into the integrated care system. So we really appreciate her sharing her insights. Up next, Liz, over to you.
Thank you very much. I feel really humbled, actually, by the experience and contribution of the previous speakers, all of which resonate with my experience of arts, health, and the power of communities. I think communities are so important in this particular field. So I thought I'd start just with a little bit about Northumberland, because not everybody will actually probably even know where Northumberland is. We're the most northerly and we're the most sparsely populated county in England. 320,000 people squashed into just 5,000 square kilometres. But our population is not evenly distributed. So about half of our residents live in areas categorised as rural, and about half live in the 3% of the geography in the southeast, which is also where our more deprived communities are. But obviously, being a rural county, we're very conscious of rural deprivation, things like poorer access to services, lack of affordable housing, higher fuel costs. Those are all really important issues for us. But as a county, we have got a very strong commitment to arts and culture, because it's actually fundamental to our economic growth as a county. We're blessed with a wealth of art and cultural assets, and we've got a cultural strategy which really reflects the council's belief that investing in arts, heritage and culture is a commitment to a healthier, more fulfilled and prosperous Northumberland. We've got specific goals in the strategy around health and wellbeing, but we've also got goals around placemaking and identity, working in partnership and economy and growth. And of course, all of those directly or indirectly can contribute to reducing inequalities. So I'm just going to spend the rest of my time talking about some of the creative projects that we've invested in, recognising that one of the challenges with this area is around measuring impact, but not just measuring impact in a consistent way. My Director of Public Health report from 2019 was focused on creative health. And we asked people, why does art matter? And they said art matters because it gives them confidence and it improves their lives. It enables people to express their innermost thoughts and emotions in a creative way. And it gives them ways of looking at the world and makes them feel really emotionally attached. And the Literacy Trust talks about, for instance, the benefits of regularly reading to a child, talks about comfort and reassurance, confidence and security, relaxation, happiness and fun. It tells children that they matter. It builds self-esteem, vocabulary, it feeds the imagination and improves their sleeping patterns. Those are all the words of the Literacy Trust, not mine. We use our children's centres to try and support that approach. Children's centres really focus on providing a strength-based approach to enabling children, young people and families to build capacity and increase resilience. And we've had an artist residency project across 6 of our children's centres with 7 artists over 9 months. And that was really introduced as a theme to encourage a more sort of person-centred approach to early help support. But that involved over 900 children, young people, 678 parent care participants, including lots of grandparents, and 38 children's centres staff. So we do lots of work in the children, young people arena. We've got a nursery that actually has prioritised the arts as part of their curriculum offer. One of our longer standing projects is the Creative People and Places programme, which is funded through the Arts Council. And that's had additional investment from ourselves and other partners. And locally, that's called BAIT, B-A-I-T. Nationally, the Creative People and Place programme was very much focused on parts of the country where involvement in creative pursuits and culture is significantly below the national average. And in Northumberland, it's really focused on the southeast, and it's worked with groups most likely to be experiencing inequalities. So those living in our most deprived communities, refugee and asylum seekers, and carers. And we've measured impact using the Warwick Edinburgh Mental Wellbeing Scale, WEMWEBS, to assess changes in mental health and wellbeing as a result of taking part in those projects. BATE Projects has also teamed up with Bridge, which is one of our local employability projects, to work with a group of residents using a range of creative art opportunities. And the aim there is really to improve confidence, self-esteem, reduce social isolation. But in doing that, it's brought them much closer to the employment market. And in each year of delivery of the BATE programme, about 3/4 of participants reported improvements in wellbeing via WEMWEBS. There are also knock-on benefits of that work because a number of partners now recognise the value of engaging their clients and their local community in creative activities, and they've used the quantitative data gathered in partnership with BATE to successfully bid for funding for the continued use of creative activities to achieve a whole range of arts and non-arts impacts and outcomes in some of our most marginalised communities. And actually, David talked about arts being a lifesaver, and that's absolutely the comment that was used by individuals involved in that particular project. So another project that we've invested in is called Reading for Wellbeing, and this is funded by Anne Cleves, the author, and a number of local authorities across the Northeast have enabled community reading workers to support local people to access books and to experience the pleasure of reading to improve their wellbeing. And there's lots of evidence emerging around the therapeutic value of reading for pleasure. And a growing number of studies have found really positive links between reading and health, particularly mental well-being. But the reading workers are working in communities experiencing high levels of deprivation and where literacy levels are particularly low. And we know that low literacy skills also affect health literacy. And of course, the people who most need support for reading are less likely to have the material resources to buy books and to access care. So our wellbeing coaches provide practical help. How can people access books? How can they access spaces and places for reading, as well as emotional support around, for instance, confidence in reading and relationship building. And the idea is that that will improve mental health and wellbeing and also improve health behaviours with the aim of supporting better longer term physical and mental health. And I think by working in areas of high social deprivation, it aims obviously to support communities whose health needs are greatest and then help prevent future health problems for individuals and wider communities. And that whole project has been being formally evaluated by the NIHR Applied Research Collaboration for North East and North Cumbria. I think at a more strategic level in Blythe, which is one of our priority towns for levelling up funding, we're enhancing the culture offer and building on what already exists in Blythe to regenerate the town centre through the development of a culture centre, and that stemmed from consultation with local people. So a feasibility study and a business case set out the hub model, which is going to include a community cinema, flexible multi-use space for performance, education, health, wellbeing, cafe and creative play. And through a series of creative projects, we've built fantastic relationship with partners who work with those who are often marginalised, so they feel valued and appreciated, and hopefully will come to see the culture centre belonging to them. There's lots of other ways in which we've used the arts for health promotion. Melva is a theatre production delivered by a company called Mortal Fools, which has helped improve the mental and emotional wellbeing and intelligence of primary age children. And I think going back to Rosie's presentation, theatre and drama is just a fantastic way of exploring issues around things like mental health and healthy relationships with young people, because I think it just resonates with them more. And at the other end of life, the arts can support people to age better and reduce social isolation in older adults. We've got arts-based projects for people with dementias and their carers. We've got other projects for older people which are there to try and support sort of falls prevention through dance classes. And finally, we're working with our integrated care board at Place, and we're co-funding an Arts for Wellbeing coordinator to work across Northumberland to get the Arts for Wellbeing agenda much more fully embedded. I think as far as we're concerned, engaging with the arts, it's not a luxury. It's something that everybody should have an opportunity to engage in. Thank you very much.
Liz, thanks so much. I mean, it's really inspiring and heartwarming, isn't it, to hear from a director of public health who's so enlightened and, has that deep-rooted understanding of how community-based, arts-based, creative approaches can support health prevention and intervention. It's really fantastic. Thank you so much. And I think that is going to chime with some of the thoughts that we're going to have from our next speaker as well. We're really lucky to be joined by Ruth. Ruth Bromley is a GP and clinical lead for homeless health at Greater Manchester Integrated Care. She's also lead for ethics and law at Manchester Medical School. And I think the ideas around training and how we're supporting our growing body of medical professionals and beyond medical professionals, people who are working in statutory services, is really important, so they understand, again, this wider social determinants of health and what we really mean by inequalities. So appreciate you joining us, Ruth. Ruth's going to provide a clinical perspective on how creative health in her GP practice, both the challenges and opportunities that brings. So over to you, Ruth.
Thanks so much, Helen. So if I'd have had one ask for today, it would have been that we use authentic voice. So I almost feel like I should stop speaking because I think we've had that. And if I'd wanted one thing, it would have been that we concede power and give it to the communities whose lives we're talking about. So thanks for letting me speak. Some of the things I was going to say have been said, so I don't want to sort of cover the same ground. So I think I'm going to take you up on the opportunity to talk a little bit about the state of play for people working in the NHS at the moment. So forgive me, I don't mean this to be introspective, but if we as statutory organisations are to be part of the solution, we need to support colleagues to be able to make the offer that you need. So just to give you my background, I'm a GP in Wythenshawe very proudly. I've worked in that part of Manchester for the whole of my career. At one time, we were the largest council estate in the whole of Europe. And most of my patients survived despite the system, not because of it. So one of my worries is when we're in circles like this, we hear amazing things about brilliant projects. And I'm in a region where we have a creative health strategy and we're very proactive. But there are still many people that I think probably don't even know that any of these projects exist. They're struggling day to day. And a very common scenario now for me in my consulting room, and just really stark example of where we are, is people saying to me, don't talk to me about diet in terms of my diabetes. I can't afford to eat differently, just put me on medication. So that's the kind of sense of how people are coping on the ground. So this idea of utopia and human flourishing and joy and hope, it's an oppressive space in which we're trying to create that environment for people. I'm a trustee at Home in Manchester, which is our contemporary arts centre. We do a lot of community outreach work, and it's absolutely written into our strategy that we want to promote hope and joy and flourishing. But my patients, struggle every day against what has now been over a decade of austerity. So we have to be realistic about the environment we're in, and we need to be challenging and proactive in how we, speak for our communities, but more importantly, as I've said, allow our communities to speak for themselves. So within that, I think what we've seen is some real successes where we've created groups and there's been support, but it's still doing things with people. It's not autonomous most of the time. And it's great to hear that there are other examples that are moving that forward. So through my homelessness work, we've had some amazing sort of arts projects. Fundamentally, I think what we need to do is embed arts and creative health as part of the therapeutic offer that we make to patients without medicalising, without saying that this has to be held by the NHS. It has to become core provision, and it just isn't. So I don't know if any of you heard the news on Radio 4 this morning, but the long delays that we're facing of people coming out of ambulances, can't get a GP appointment, my colleagues are burnt out, their own mental well-being is stretched, and we're facing strikes through the winter months which are unprecedented. So we need to look after our workforce so that our workforce can then look after others. And it comes back to the points that other contributors have made around mature long-term funding options where people can build a strategy around providing therapeutic care through creative health into their day-to-day provision. We just don't have that capacity at the moment. On Monday, I fleetingly mentioned to my colleagues that I'd like a conversation at lunchtime about their experience of working in a primary care network or access to community arts in preparation for today. We didn't get a lunchtime on Monday. And when I spoke to them, they just said, I can't have this conversation right now. I can't cope with it. There's 200 patients trying to access us through our internet, access points. So it's about trying to create space. It's about making it core provision for patients. And then particularly, I think, looking to a preventative strategy. So many of my patients grow up with trauma. So Kelly and David have both, referred to their own experiences. That can feel like most of the patients that I see. And we absolutely know that early intervention through arts and health, creative health, can make a difference and heal children in real time. So we don't create a legacy of trauma in children and young adults. So how do we reach every child? How do we reach every family living in poverty? And how do we enable my colleagues to put these kind of choices for people's lives at the top of their options? I think that's probably all I want to say. There's so much to celebrate, but there's so much still to do. And I think it's perhaps a campaigning voice that we need to develop as much as a celebratory voice as we move forward.
Thank you so much for that, Ruth. And also, I think the importance of talking about the challenges ahead, because it is a big challenge. But that's why we're so grateful to you all today for sharing your experiences, because we really think that gathering together that voice and gathering together the evidence from all of your experiences is the best way in terms of advocacy and activism. And that is a large goal of the Creative Health Review. And as we're working with wider national partners, feeding that into, we hope, government strategy and thinking about what could be these challenges, particularly around funding, but also around integration and what that really means and how we could think about doing things differently. And that's why all your experiences are really, really valuable in that, because I think the only way is going to be co-creating these solutions together. And just the conversations that Alex, Lord Howarth, myself, many others here have been having, whether it's at local, regional levels, for example, ICSs, or at national levels, is there is an element of misunderstanding about how to tackle these really complex problems. We know we've got the solutions. Kelly and David have just beautifully talked about their own experiences of how you can do that, and you've all got numerous examples like that. So we do have the answers, but we do need to think about structuring that and funding it and supporting it in a different way. And we're all part of hopefully helping to solve some of those challenges, but it's not going to happen overnight. And that's why these insights are so helpful. There's lots of fantastic discussion going on in chat. We're going to be taking a break in a minute, but please can I ask you to spend a little bit of time while we go and get a cup of tea to have a look at what's going on in chat and really think about the questions that you would like to pose to our brilliant panelists. I think we can have a really exciting discussion going forward about perhaps doing some brainstorming around these really thorny issues of how we capture those insights and how we challenge that and challenge the different statutory services, how we challenge funding models, both at regional and then at wider national levels. So I'd love to have a discussion about that. That's a big piece of work that we're doing around this investment from UK research, and there are other funding bodies out there that are interested in this, particularly around local authorities, for example. So I'd love us to have a chat about that. I'd love us to talk about thinking about capturing those experiences that Kelly and David have talked beautifully about, what the best way to do that is, how to capture those voices. I think that the brilliant activism that Josie talked about and Rose, and in terms of those, how their organisation started, how we capture that and share that, and how we spread and adopt that, particularly to those areas that aren't represented. I was talking about Blackpool because I'm from Blackpool, and many of you may know Blackpool is one of the poorest boroughs in the country in terms of health predictors, in terms of life outcomes as well. So I know exactly the sorts of communities you're talking about and have come from one of those communities. So there are many challenges ahead. Please, can you start posting your questions in chat? If you've got a particular speaker you'd like to direct your question at, otherwise I will get your questions responded to by across our whole panel. And continue to share your experiences and information in chat. But a reminder to put your questions in the Q&A bit, because it's very hard for us to pull them out. So we're going to take a break now. We're going to come back at 15:15. So you've got just over 10 minutes, which is plenty of time to post stuff in the Q&A and get a cup of tea. Please join me in thanking all of our speakers so far. Once again, we've had some fantastic insights. We really, really appreciate you sharing your experiences and insights. So thank you very much. There's been a lot of love in chat. So if you do get a chance over a cup of tea as well, please do have a read through that. And we'll look forward to seeing you at 11:15 back here, and enjoy your break. Welcome back, everybody. Hopefully people have got their cups of tea and coffee and had a little bit of a comfort break. We'll just give people a few seconds to arrive back. Welcome back to our panelists. So we're going to start this session. Please do, everybody, keep posting your questions in the Q&A section. I can see we've got a few arriving. We're going to spend, I think, the next sort of 10-15 minutes just having the chance to hear just a little bit more from our panelists, addressing a few specific questions that we wanted to get them thinking a little bit about. And that's really around how we can get arts and creative and cultural opportunities available to all, and how do we make sure that creative health doesn't reinforce inequalities? And Ruth, your last presentation, you sort of highlighted that a little bit. And so I wondered if you could all have a think about that. Maybe David, you could kick us off really, because you've come from your own personal experiences and then, you know, gone and set up a charity and organisation that is working with some of those people that really are excluded from a lot of those sorts of services and opportunities that we might be talking about. So maybe you can give us some insights on that.
Yeah, totally. So I come from this background of what we call rough sleeping. So people actually sleeping on streets and stuff. And that's only a small percentage of when I talk about homelessness as an organisation. I look at it from the whole broader aspects of people sofa surfing, etc. When thinking about culture for my community, when I was trying to get back on my feet, it was really, really difficult to get my work seen, because it was really difficult to get myself taken seriously. You know, I remember because I set up a festival, the One Festival of Homeless Arts, if anyone wants to know. It is running next year, January. But the reason I did that was because nobody was helping us out. There wasn't any organisations. There's the arts organisations, but no cultural spaces or anything like that. So I was like, well, actually, I'll start a festival. We'll start building that up, and then they're taken seriously more as artists. And we've now got this massive, massive network of homeless artists around the world, right? And through that work, that's how I then got in touch with Matt. And Matt was the first person ever to email me back about the festival, which is amazing. He probably thought it was this mad homeless guy, hasn't got a chance in hell, like type thing. But I think people seem to forget that our community it's strong, right? And they're stubborn, and they don't give up a lot. So it's about bringing those elements of the community itself, right? And working with them, not for them, right? Because we as an organisation, I know me personally, I got really fed up being told, you know, all we're going to have for lunch is a Pret sandwich, right? I don't want that, right? I want to go and sit in a Ritz, like, you know, but it's about building a structure where everyone has their individuality, and listening to all those voices in the room. Every single one of them is important, from the chief exec to the homeless dude sat in the corner, right? They're on the same relativity. And it's amazing when you see this change. So obviously we do a lot in cultural space, city councils, as I was saying earlier. And we saw over the last few years, especially the work in Coventry, the impact that that's had, not just on the people they're employing with homeless experience, right? But council level. And now the head of homelessness is mentoring homeless people to then come and work in the council. It's such a massive success, right? And it's such an easy implementation, right? Because all we have to do is include these voices when writing strategies, right? So instead of like us like in a corner writing, and this is if it was me without lived experience, we got to bring those voices, and they are first and foremost to be listened to. And we've seen it happen. And, you know, just from the impact, because you wanted to hear about a couple of the little projects as well, didn't you?
Yeah, that'd be great. Thank you.
Yeah, I was talking to Hannah about this. I got quite animated the other day when I was having a chat with her about it, because I'm really passionate about this, right? For example, right, we've got this homeless group in Johannesburg, right, called JAM, Awakening Minds. They are probably the most inspiring group of actors I've ever come across in my life. Every time I see them, I cry. I can't help it. They are just like, it's just so powerful. They performed for us yesterday at one of our art lab inquiries, and they do Chekhov and Shakespeare, right? They're homeless, right? And people go, well, you know, it's nothing, right? But for these guys, they never had access to that, like literature and stuff. So to then to be working and building these amazing plays, and you see it and you feel it as a viewer as well, right? So it's not just them who are benefiting from that art, it's everyone around them, everyone. And we see this progression from when working with people instead of for them. Matt always says, we want people to thrive, right? We don't want them just to survive, right? Because we're all fed up with just surviving. We all want to be listened to and taken seriously as artists, right? So it's about bringing those elements along, and there's so many intersections, like, you know, across disability arts, etc. They all sort of like knit together, and I think that's how we start to build this new mechanism. There's something Kelly mentioned earlier, actually, I really wanted to pick up on, and it was like the funding side of things, right? Somebody like me, I don't have the knowledge of how to apply for funding, right? I never have, right? So instead of applying for it, I just do it. I just go out there and create the things out of my own pocket and time. And I feel like that's what the grassroots teams do across, you know, I know Josie was saying about having volunteers and stuff like this. It happens all across our sector. And I feel like sometimes we have to stop relying on this. We have to sort of like embed that into our infrastructure, saying, right, we're going to have volunteers, but are they getting free meals? Are they getting bus tickets and stuff like that? Because I know my homeless community, they would not be able to get to the job without a bus ticket. So it's trying to think about all those little questions to make that person's chance a little better. We had an artist in Justice Museum recently, and when she first went for the interview, she cried because she didn't believe that it had been taken seriously, that she was given an interview there. And then when she got offered a position, she'd been working with them 6 months and then came onto our associates program. And I can't believe it's the same person, right? She's just curated the show that they've got in the National Museum there now, and I'm so proud. I went up there last week. I was crying. I cry about everything, because I always say, and I say this, and I think Kelly will agree, I can't grow as a person if my community doesn't. Mm-hmm. And I think, like, you know, we're all like that. You know, when you've been through that sort of life. So yeah.
Thanks so much for that, David. Yeah, I mean, absolutely fantastic insights. It's really, it is heartening to hear about how, you know, that grassroots approach, but you're absolutely right. We've got to move beyond that kind of, you know, the volunteerism and the small scale funding. We've got to think about that, how that spread and adoption, it also is adopted funding wise. Yeah, exactly. In terms of strategies.
Helen, I agree. And just to touch on that, it's like the implementation into a council level is simple. Right, we do it through legislative theatre, right? And we bring the best in from the world, and they create theatre spaces with council members and the community themselves, and they build these plays, and then they work on the strategies that they want to change. And it can be that simple, and that will have a lasting impact.
Well, and looking at, you know, where those investments are already happening, you know, we need to get, I mean, our big argument is that it's got to be investment in the sorts of organisations you guys are working with and for and have set up. And perhaps we might argue less so in some of those organisations that are already very rich. Kelly, did you want to come in, or any of our other panellists want to come in on this discussion of creative health approaches? Kelly, Josie, Liz?
Yeah, I just can't second just obviously what you've all saying, that I just want to bring a point in as well, like, because obviously, like David just said, like, we do have to like take some responsibility sort of ourselves and try and stop relying on other things and just keep on at it. And what one thing I'm trying to do with my photography is link it back in with the schools, like music, art and drama. But I'm trying to take away, you know, the old traditional school photos thing, get rid of them. They still get a photo for the families and all that for free, because we found the money to rent, you know, to create this event. There is other ways of doing it, but we do need people on board to support it. And that's, you know, getting everyone linked together in the communities, and people need speaking together properly.
Thanks for that, Kelly. Josie and Liz.
Kelly just mentioned schools, and actually I just want to talk a bit about education. I taught for 24 years. I was an English and drama teacher in both the state sector and very briefly in the private sector as well, and saw the utter erosion of cultural education. It wasn't great when I started in 1989, and it was absolutely horrific when I left in 2012. Everything had become about STEM. Anything to do with art, creativity, children's imaginative engagement was just regarded as frivolous or a waste of time. We're seeing post-COVID that the so-called catch-up strategy, well, little people's brains are shut down and they're in a state of trauma. Giving them more maths and English is about the last thing that we should be doing. What we should be doing is playing. Because art is all about play. It's about mark making, and it's about dancing and singing. And you know, I've worked with EMU works with the NSPCC with a project called Together for Childhood. We're one of 4 Together for Childhood towns in the country, and we take a preventative, early help, strengths-based rather than deficit approach to interventions with families. And I say we because I actually was working as a paid children's services practitioner for 9 months this year before I moved back into the community. And I could get very exercised about education. I had free music tuition at school when I was a little kid. You know, I was taught violin for free for 10 years. If we could do it in the 70s and the 80s, we can do it now. We can give children instrument lessons. We can have school choirs. We can have school plays and drama clubs. We can have all those things. But we've been told this ridiculous kind of story of, no, you can't, it's a luxury, it's not essential, it's not core. And I think unless we start banging the drum and shouting very, very loud and getting quite angry, actually, I think the time is for righteous anger right now. And say children have an absolute right to these things. And unless we're doing that with children, unless we're playing with kids and doing these wonderful things that can be done in these fantastic interventions, then, you know, you can't start when people are in their 30s, 40s, 50s, or whatever. You have to start when they're babies.
Yeah,
so
completely. No, that's really well made. That starting early years, and Dahlia's put a good point I was going to raise. And you know, these things don't have to be separate, so you can teach core subjects like maths and English, you know, with arts creative. The same with the outdoors, asking people to be healthy, but we're not encouraging them to go outdoors and be physically active.
Can I just say I'm not anti-STEM at all. I just think it's dominated to the detriment of everything else, and I just think we need to. We did it well before. We can do it well again.
Completely, and to the detriment of those subjects, isn't it?
Yeah, and obviously back from being in school myself, like struggling with dyslexia and everything, and I didn't have that, you know, person-centered approach. I was put into a group and forgotten that were just troubled kids. Do you know what I mean? But then on the outside of it, when I did get counselling, the art got into it, and it was brilliant, and that's because it was person-centered. You know, they treated it on a person-centered way. And I had battles and struggles because of schools, you know, but we did have it. We just need to get it back.
Yeah.
I know it's a bit
Brilliant. Thank
diverse,
you.
a bit yin yang, but yeah.
Yeah. Liz, you were going to come in on that point, and I'll just take one more comment from Liz and then we'll move on, because I'd like to get to our questions because we've got quite a few in the chat, so I'd like to get our panelists' views on those. But Liz, you wanted to come in.
Thanks. I've been so engrossed in the conversation that I've actually forgotten what the original question was, but I think it was about culture and creative opportunities and inequalities.
Yeah.
And I think there's no doubt that actually culture and creative opportunities are not equally available. And I think some of this is down to the way that we fund and assess the arts programs that that are supported. So depending on how those activities are developed and promoted, they can feel really exclusive. And in my experience, often cultural activities are funded, and their a successful outcome is determined by the number of people that have participated rather than the quality of the engagement and the longer term impact. So we do need a blend of both, and we can avoid making inequalities worse by actually building equity into our arts and cultural programs. So who is least able to engage, and what interventions do we need to put in place to overcome those? That might include working with partners who already have relationships with those people. So, the Creative People and Places program where I am, we've worked with housing colleagues, we've worked with children's centres to engage with groups who are least able to access opportunities. We've worked with community venues, we've worked with BAME workers, youth groups, so that we can, include as many diverse groups as possible in shaping that cultural offer. And in our sort of outreach programs, we need to ensure that diversity and inclusion is a central component of those. And it's, I think from a strategic point of view, it's, we need to shift our thinking in terms of what makes a successful program. It isn't just the number of people who come through.
Yeah, completely agree, Liz, and actually that's a part of the Creative Health Review and this wider programme of work that's going on is with multiple partners, including organisations like NHS Personalised Care and the National Academy for Social Prescribing. We're really keen to look at that because there is this focus on health outcomes, but what about those other sorts of life outcomes that really speak to the social determinants of health that we've heard brilliant examples of today, getting people back into meaningful and purposeful occupation, employability, improving their life chances. We know that there's huge potential around that. Kelly and David have beautifully spoken about that in their own experiences. So yeah, it's I guess that wider opportunity around integration, but thinking about what do we need to overcome that, and we can maybe come back to that because I think there's a few questions on that in our Q&A. So if I can direct some questions, I haven't got them specifically for any one particular panelists, but I'm going to start off with Eamon's question, and there's a question here about one of the barriers in terms of health equity is, he says, is the way that in which people with sight loss are often inadvertently excluded from services. And so he's wondering if you've got any experiences of that, particularly, for example, issues around the accessible information standard, which is not being widely adopted. So ideas around how you can remedy, I guess, access for services for a particular group that he's interested in around, for example, people experiencing sight loss, but I guess that could apply to other groups who might be experiencing difficulties in accessing services. Ideas around that. I mean, David, you've got a lot of experience of this from individuals and your community.
Yeah, I think it's such a, the question's quite wide in a way if you think of like all the different social aspects that we're trying to cover, and there are always going to be barriers. So for me, it's important working with cultural spaces to take away a fear of our community, because that's what it is. And it's same with the migrant community, the traveller community and stuff like this, right? There is always this fear and negative connotations to it already before we've even started. So it's about breaking those stigmas. It's what I do in my daily work as an artist, and then sort of like trying to reintroduce a new narrative, right? And the only way you can reintroduce that new narrative is by bringing people with that lived experience, not just as advisors or consultants. No, I'm past all that now. Like, you know, I want them sat on people's boards. I want them in the boardrooms, like actually on par, saying, look, this is my community we're talking about, right? And you've shut your doors for so long. I'm blind, I can't see that they're shut. I keep walking into them, right? So it's that sort of thing, saying this shouldn't be happening, right? Because it's illegal, right? So it's about sort of like trying to help with cultural spaces and organizations just to find a level balance, right? You know, so we can all have that same sort of approach. And even if it's just, I know when we did an opera in Manchester, we provided a whole day where people come around with sight loss to actually touch all the scenery and to get that visual image before we even did the show. And I think it's those accessibility things are really important. I think it should be included more in funding bids, but a stipulation I think should be in there from the funders as well. Like they say, look, if we're giving you 40 grand, we'll put 10 grand in for accessibility. That's what I'd say to them.
That's super helpful. And I think that's such a brilliant point about that, you know, the collaboration with a, you know, a community-based, a cultural organisation, that's the route into helping to target those individuals and populations who are really struggling to access services.
And then it has that ripple effect.
Yeah, and that sort of reinforces what we're saying, isn't it? That you know, the community-based approaches are the only solution really to tackling issues around health inequalities. I wanted to come on to another question. I don't know if anybody wanted to respond to that specific question with experiences of people with sight loss, or you're happy for me to move on to questions. We've got lots of questions. We might not get through them all today, so apologies, but I'll do my best, everybody. We've got a question from Jonathan about, in primary care, we see patients suffering the downstream consequences of deprivation and exclusion all the time. How can we work more effectively as advocates for social justice rather than solely trying to treat the diseases that we see as consequences? Yeah, we've got some big meaty questions here. Who'd like to come in? I mean, Ruth, Liz, yes, go for it.
So this is something I was going to mention in the last question, so I'm glad I didn't. I think the recurring theme that that's been discussed is particularly with Josie and Kelly is around the strength in communities. And you know, we've absolutely got to shift away from a deficit model to an asset-based positive, you know, an asset-based approach to health. And in Northumberland, where we've got an Northumberland Inequalities plan, which isn't just a council plan, it's a system-wide plan, which is absolutely shifting our approach to asset-based community development. So looking at everything through an asset-based lens. So what can communities do for themselves? What can communities do with a little bit of help from us? And actually, what are the things that communities can't do and that have to be done by statutory organisations? And you know, because we can't keep doing the same old thing. We've got to do something different. And I think communities are absolutely at the heart of it. You know, they can do amazing things. Just one example that was brought home to me was, and it's only a tiny little thing, but somebody that I know was talking about a book club that his wife went to. The book club has never actually read a book. That the strength in the book club is around the mutual support that's provided by the people who participate. Nothing actually to do with reading books. But you know, communities can do amazing things, and we need to trust them to do them.
Yeah, that's really powerful. Thanks, Liz. Ruth, you were going to come back on that question.
Yeah, I mean, I think the other bit, again, and sorry not to make this all about the NHS, but obviously it's a huge infrastructure and we are part of the solution, hopefully, but we've just formed hierarchical boards up and down the country. So we constantly go from big to small to big to small. And I think one of the things we have to do is ask difficult questions of our ICBs. So, you know, where is the public voice at board level? Where is the voluntary sector voice at board level? Where is the money moving? How fast are we devolving the funding to community? And how much are we trusting our communities? And I think it comes back to a couple of points that other people have made earlier. We don't like kind of outcomes that we celebrate in the creative world in healthcare, because they're not numeric, they're not often delivered in short term, and actually just feeling better isn't valued by the NHS, and yet we know that over a lifetime that might significantly improve somebody's life expectancy. So I think we have to be compelled by some means to trust the voices of the people whose lives we're talking about more. I think my other real weariness, and this isn't about Manchester or Greater Manchester, it's about working up and down the country over the 2 years that we transitioned to ICS and ICB, is there's become a middle class mantra which makes professionals feel very good about themselves because they're helping other people, and it just holds the power in the wrong place. So, you know, simple things that would make a difference. David said it at the beginning of the morning, but people who start to feel better lose their benefits, and yet they might still need their benefits, but they want to participate in activities and be, you know, a very meaningful member within their community. So there are perverse disincentives which we need to ask our new infrastructures to challenge and work with us to change. We have tried very hard in Greater Manchester to work collaboratively with DWP, but time and again, particularly with people who've experienced of homelessness, we've really struggled. And the single best difference that we saw in my time was when we had everyone in, and we could actually sit alongside a community of people who designed their own solutions, but we were in that free thinking space where there were no rules, there were no target measures, and we allowed some of the most sort of gifted and inspirational members of our homeless communities to devise the plan that works for them. And we are still benefiting from that, but we're very quickly losing that positive legacy of COVID. So we also, I think, need to capture a bit of that again. Final point is, I don't believe there's much energy for anyone who's working frontline at the moment. And it isn't necessarily the best placed position to look for solutions either. So what we need to do is create the capacity and capability within formal infrastructure, but where we allow our voluntary sector partners to do absolutely what they do best, which is create bespoke and holistic solutions that meet the needs of individuals rather than serve the needs of organisations. So there's lots we should be challenging back on, and I think now's a good time because ICBs are wanting to help do these things, but I don't think we should be looking to them to be the solution. They should be a facilitator. Sorry, final point is also how we define art. We haven't really explored that very much, but I can see it going on in the chat. But in my community, it might be a boxing club, it might be making gift cards in a nursing home, it might be the knit and natter group that works in the Forum Centre. And I think there is something about valuing all kinds of creativity. High-end art has a place, but it isn't everything, and we do lose people when we only think about the kind of formal infrastructure of the arts world as being the solution. I'll stop now.
That's really helpful. Thanks so much, Ruth. And that point I think is really well made about, you know, some of the challenges even with using the term art. I mean, the stories and voices we've heard today about the power of, you know, it's really been the community grassroots activism approach, isn't it, that has led to those change. Josie's got a hand up, and I can see David's got his hand up as well. Josie, do you want to comment on that?
I think I just want to echo in some ways what Liz and Ruth have just said about this doing two model that has failed time and time again. If you do two people, it doesn't work. If you stand with people and you take the asset-based approach and an upstream approach, we've got lots of interventions going on in the East Marsh from various organisations which are totally downstream. They're totally downstream about fishing people out of the river and not asking why they're in there in the first place. And this has gone on for decades. And, you know, one of EMU's big challenges is to really try and change that thinking at kind of structural sort of level locally. And I think we're beginning to make some headway, but I think there's still a belief that the great and the good know best. And they will come in with their wonderful plans and their ideas and their schemes and impose them on a community, then wonder why the community goes, huh? nothing changes, and the same, and the situation perpetuates. So I think that, you know, the fact that we're talking about, you know, upstream working is really positive. And I think also that issue of capacity, you know, my heart bleeds, it absolutely does, for anybody working in frontline services at the moment. I just don't know how people are doing it. It is horrific and inhuman, and we are tolerating the intolerable, as we do too often in this country. But I think, you know, putting support in from those assets that are out there, from people who want to help and can help, where they are on the ground in those communities, is so vital. One of the big pieces of work that the NSPCC has done this year is asset mapping across the 2 wards that it's working in, looking at where the strengths in those communities are, where you might find that expertise. And we also take the Freirean approach here, Paulo Freire's work, you know, in Brazil from, you know, a long time ago now, that expertise is in communities. People know how their lives work and what will work for them. So why don't we just ask them, rather than tell them and say, right, let's do this together. You know, let's bring in expertise where it's required. Let's bring in knowledge. But, you know, we can't do everything. But if we start with where people are, then I think we've got a much, much greater chance of creating and pivoting to real lasting change. But if we keep going, no, I'm the great and I'm the good and I know exactly what all you poor people need, nothing is going to change. Nothing.
Yeah, very
Sorry,
well
I got
said.
a bit pompous there, didn't I?
It's very, very well said, and I'd like to pick up on some of those points. David, you were going to come in on that point as well.
It was literally two points that were mentioned by Ruth, actually, and I love Ruth's work up in Manchester. Like, you know, we hear about it all the time, and for me, like, I did a massive show up in Manchester at the Mayfield Depot, which was looking at my experience, right? And it's when you're talking about the DWP and this, it's just so frustrating, because so I had a stroke, cancer, the whole multitude of things to cause me to become homeless. But when I started to get back on I had my disability taken away from me, like the PIP, and I went, but you've signed me off for life, the doctors, right? They were like, you're never going to be fit enough to work, right? And I went, so how am I supposed to survive on £300 a month? That's what they were offering me. And I was like, I was between 2 walls. I was like, well, what can I do? So I ended up finding, actually, I can go self-employed, right? Because then I can choose my own well-being, what I wanted to do. But I shouldn't have been pushed into that process in the first place, so that fear, right? And I feel like that's where the DWP can make changes, right? They can make it accessible for everyone out there, right? Because at the moment they don't, right? But they did do a scheme which paid you, I think it was like £50 every 2 weeks or something to go into self-employment. I can't remember the name of it. And then you have an advisor, but that's only for 6 months. That's it. Like, most businesses take good 3 years to go into profit. I was quite lucky anyway. The other thing I wanted to pick up on was when you talked about the Everyone In campaign, obviously that only happened because of all the grassroots organisations putting pressure on the government. And we did a lot of work in the hotels. And what we did, because they were suddenly locked in these cells, like going mad, we created this co-produced arts program, like where they could like have people phoning them up to reading. They had pizza nights, they had film nights, you know, and it was all paid for by the councils. And this was Haringey, I think, Coventry, I know Manchester were doing it up there as well. So yeah, and we've got a, I don't know if Matt's still online, but I'll get it put up in the link, the COVID responses as well, because that was really powerful as well, because it was so simply done, just putting postcards out and talking with people saying, can I get you a puzzle or something, like, you know, whatever, what do you want? And then it created this platform of like guidelines, right, that we put together, and it's been brilliant. We've had loads of cultural spaces take up on it.
Yeah, that's really helpful. Yeah, that's really helpful. Thanks, David. And actually, your point there, I think, about, you know, how this links into things like, you know, not just the service provision, but things like benefits and how they're distributed. And you know, that's something that we could think about looking at as part of this review, is, you know, that we've got creative solutions, and again, go into the community to source those ideas for what, you know, some of those services and how those services are provided actually causes even worse inequalities, doesn't it? But again,
totally,
that grassroots approach. I wanted to come to some questions from Gweno, because I think it picks up some of the topics that we've been thinking about here in terms of some of those funding challenges, which is around how we collectively can collaborate with each other and across the system, not just arts, culture, communities, so that we're not duplicating or in competition for funding, Gweno says. And that links into another question about developing trust between those organisations. So I don't know if you guys, I mean, Rose, would love to hear your thoughts on, you guys do a lot of collaboration. All of you as organisations have talked about different types of collaboration with different sorts of organisations. Josie, you've talked beautifully about that kind of holistic approach and the examples that Ruth and Liz have given. Who wants to pick up on that? Rose, do you want to have a go first?
Yeah, absolutely. I think this is a really great question, particularly around funding, because we all know that funding pots can be just for a couple of years. And when we're working with people who, particularly like young people who may be experiencing challenges, like where that project ends, you know, we want to make sure that our experience with them isn't flash in the pan, that we're not just leaving them at the end of that process. So I think it's something at Contact that we think of a lot, and we do work with quite a small group of young people in comparison to other young people's organisations, because we really want to make sure that they are supported and we can direct them to other opportunities. So whether that's through encouraging them to go for another kind of programme, or engaging with our drop-in service, or we have like a young changemakers consultation group, which is a paid opportunity where they can feed in their ideas into our organisational structure. We are always looking at the options, and we do work really proactively with different organisations in Manchester, because we realise we aren't always the best placed for advice. So it might be working with the 42nd Street, which is a mental health charity for young people. It might be working with Reclaim, who are a working class activism charity for young people. And I think really kind of utilising our networks and realising when we can connect people and support them in a 360 approach, and not just in that art project setting.
Brilliant, thanks Rose. Who would like to come in on that idea of collaboration and not competing for funding, and collaboration, particularly, you know, Liz, you've talked about some fantastic initiatives there that are really joining up again around those wider determinants of health, and can you see sort of, you know, good routes into that for organisations, to that linking up, you know, across arts, creativity, but maybe some of those other challenges like we've talked about, housing, debt, that's going to be, you know, is already a big issue, food poverty.
I mean, I suppose sort of going back to the original question was about funding, wasn't it? And I think part of the challenge is that I think cultural organisations and artists, they want to be inclusive, they want creative activity to be accessible, but actually a lot of the funding is often on a project-to-project basis, and it can have very different criteria. And I think also sometimes VCSE organisations, they're sort of just, you know, they're really focused on the sort of job at hand, and actually sometimes there is a strength in collaborating with other VCSE organisations. But in some areas, I think that probably happens better than others. So I think there needs to be a sort of a strategic understanding and commitment to formalising arts activity to support health and well-being in its sort of widest sense. And I certainly think that these dedicated strategic creative health posts will support how arts and health is embedded into the NHS and social care system. But of course, healthcare is only a small proportion of what makes us healthy. It's, you know, how can we embed arts and health into, you know, as you say, into housing, transport, all sorts of other activities. I mean, actually talking about that with in Northumberland, we're developing the Northumberland line, which is basically extending passenger rail services from Newcastle along a route which was actually already used for non-passengers, but we're opening it up to passengers to make that southeast corner more accessible. And there are some arts installations going up which have been produced by schools, where the new train stations are going to be. As I said, we've got schools, local schools involved in developing arts installations to support that activity. So I think that, you know, there's lots of opportunities if we sort of think in a slightly different way.
That's really helpful. Liz, Josie, you wanted to come in.
Yeah, I think one of the issues that maybe we haven't touched on today is just how toxic it can get in communities when you're all fighting over a diminishing pot of resources, and you can end up with enmities where there shouldn't be any. And it can be very, very hard to find, you know, common ground and collaboration when you know that you're going for the same tiny bits of money. And we've seen a big fight at national level just in the last couple of weeks where the MPO round has been announced, and there have been some real shocks for people. And, you know, it's a rock and a hard place, isn't it? I mean, of course, English National Opera should have its subsidy because it does amazing work, but so should little organisations in these little outposts all around the country that get nothing. And it shouldn't be either or. There should be enough money there for everybody. I mean, isn't the creative industry worth about 11 billion to the economy? Something like that. So why are we fighting over such small pots of money all the time? And all these organisations say, oh, we want you all to work together and collaborate. Okay, make that possible then. You know, issue enough opportunity, enough funding, enough resources so that everybody can benefit and no one has to suffer. It should never be either or, and it should be way more inclusive and open and transparent. And I know what David said earlier about accessing funding bids. I was crying over my Grantium application yesterday, crying, because it's such a frustrating and ridiculous process in so many ways. And you just think to yourself, why do I have to keep doing this? You know, I know it's the reality, world as it is and all the rest of it, but it's so dispiriting and distressing sometimes, and you get burnt out and exhausted and cynical if you're not careful. And you have to really fight against that. And you really have to stop yourself fighting with other people who are in exactly the same boat that you're in.
Well, thank you so much for raising that. And I think, you know, that we've had a little bit about this in the chat, but it should be proportionate, shouldn't it? And I guess it sort of links, we're running out of time, folks, but a topic that has come up around that kind of how we can move from the kind of nice to have icing on the cake to the kind of core. And I wonder how much of that does relate to then the evidence and how we're capturing that and how we're doing that persuading, because I think that is really crucial. I don't know if anybody's got any final kind of thoughts on that. There's loads of questions we've not been able to get to. I'm really sorry about that, folks, in the chat, but we'll do our best to direct those to panelists, and if they've got a chance, they'll be able to respond. But yeah, that kind of proportionalism and you know, how that could be an area where we could think about, you know, greater than a sum of our parts, really. David.
I've just got a really simple thing. I believe that art can bring people into a space that wouldn't normally go to a space, right? Obviously, most of my stuff is quite hard hitting social impact about homelessness and addiction. And for me, I get politicians, I had representatives from the Crown coming to the last one. I was like, whoa, what's going on? Who would never go in to see a show so depressing about homelessness, right? Because it's showing their failures, right? But art has this ability to do this, right? So if you think, if they built roads, right, which had a ridge every 2 meters down on every motorway, everyone would kick off about it, right? And so I feel like sometimes you have to put those bumps in the road to get people to listen. And it's a sort of like, I call it soft protesting, but the soft protesting has bigger impact because people listen to that. You know, with my, I've got a soldier story piece looking at homeless veterans. That has had such a massive impact across the country because it's a subject that people don't know how to work it out. But when it's coming from the community themselves, they can learn how to make an impact. So I think it's little things like that. And I think that's how you get people in. Do legislative theatre. That's what I'd do. Bring the government in, like have the whole of Parliament do a legislative theatre. Like,
I love it. Brilliant. What a brilliant way to end our session, David. I love the idea. Let's all think about how we can make that happen. Maybe Lord Howarth can get some of his chums, and then people who are, it's the unconverted that we need to bring into that theatre, isn't it? We'll have to think about how we get them in. But guys, we've run out of time. I'm going to hand it back in a second to Alex, but I just want to say a huge thank you to all of our panelists. You were all absolutely fantastic, really, really brilliant. Thank you so much for sharing your insights. A huge thank you to our audience. We've had some great questions. I'm sorry we couldn't get to them all, but we've had some, I can see some great conversation in the chat, which we will be capturing. And also then a reminder about our call for evidence. You've had it in your invite and we've had it in the chat. Please do share your experiences, because all of that evidence gathering is so important for us as part of this creative health review and as part of our making the case for bringing about change. So a huge thank you to all of you, and over to Alex to finish off our session. Thanks, everyone.
Thank you very much, Helen, and thank you to all our speakers. You're brilliant. We have had some challenge in the Q&A around equality, diversity and inclusion in terms of our panel. And just to, if people weren't here at the beginning, to reiterate, one of our speakers, Sandra Griffiths from Red Earth Collective, wasn't able to join us today because she's not well, and that would have increased the diversity in the panel. But we will respond to those questions afterwards. I just want to say very briefly, Alan is here, who is our chair. Alan, do you want to say a few words?
I just want to say thank you from the bottom of my heart. I've listened intensely. I've listened to intensely eloquent and moving and important presentations. David and Kelly have told us passionately and vividly and powerfully about what the experience of creative health has meant to them. And Rose and Josie and Liz have shown how you can actually translate strength of feeling, hard-won, grim experience into something positive, even to create joy. What the review will seek to do is to transmit those accounts from people who really know what it's about, and that righteous anger that Josie spoke about, into a message to the government and to mayors and to other decision makers in the NHS, not just to ministers, because ministers are very remote and there are a lot of people who can get things done. One of the key lessons out of this discussion this morning is the paramount importance of empowering people in their own communities. Quite astounding what's been achieved in East Marsh by local leadership and by people taking power. And Liz showed how a supportive public authority can further enable that kind of creativity and that kind of energy and that kind of passion for reform really to work, and for communities to find their strengths and to achieve with those strengths. And that, for me, is the most important lesson, that power is far too centralized, as Ruth was saying. And government and local authorities too have got to learn to be generous and got to learn to trust and not to know best, and not simply to satisfy professional self-esteem if that's what they're doing. Of course, they mean to do something much better than that, but that is too often the effect. So those are some of the lessons I take from this morning. And thank you so, so much for sharing your insights and your passions and your demands.